welcome back to the Association of Healthcare and Medicine's show,
where we explain all of the up-to-date information about healthcare and medicine around the world.
We have two different segments on today's show. Sam will be interviewing vaccination expert Dr. Diana Wilson and discussing the risks of non-vaccination.
We will also recap Noam's latest trip to Bangui, capital of the Central African Republic, where she interviewed a medical expert, Dr. Vincent Fredrickson, along with other medical personnel who are stationed there to help citizens who are currently battling the Ebola virus.
Thank you, Sam. We will now cut to the interview with Dr. Diana Wilson.
Here I am in Johns Hopkins Hospital talking to Dr. Diana Wilson, Chief Physician, who will be talking more about the potential risks of non-vaccination.
Thank you for having me. Yes, today I will explain the risk of people who are not vaccinated and what it can do to others.
What is your experience with vaccines?
Well, I've been the chief for about 4 years and a physician for 12 years. I have seen almost everything imaginable. Something that has started to stand out more and more in the hospital is that people are getting sick and those people aren't getting vaccinated. Just the other day, a patient came into the ER and was cut up by a piece of metal and discharged only after 4 weeks because he had an extreme infection. This all could have been prevented if he was vaccinated.
What are the risks of someone who has never been vaccinated?
Well, it varies on age. Young children are still building up their immune system, so vaccinations are strongly encouraged to keep them safe for violent diseases they can obtain. Children who are not vaccinated are putting other children at risk to obtain these diseases. As many as 2.1 million American children aren't getting timely vaccinations because of holes in the public health system.
What can we do that can reduce or stop these risks?
The best thing that we can do is hope that everyone receives the necessary vaccinations. We must encourage others to get vaccinated and spread awareness and information about the subject. The more people who aren't vaccinated, the more people are at risk for getting the diseases. A duty we have here in the hospital is to treat everybody equally. However, this has become more challenging when we receive patients who don't have the necessary vaccinations for certain medications or even procedures.
Thank you very much for meeting with me.
Thank you very much for having me. Here I am on the dry continent of Africa in the park city of Bangui, Central African Republic. I'm currently standing outside the main hospital where thousands of patients are suffering from the deadly Ebola virus. We will now have the opportunity to speak with the doctor who caught the virus when he came to provide medicine for people with Ebola. Hello, Dr. Fredrickson. I'm with the Association of Healthcare and Medicine. Thank you very much for speaking to me today. The reason why I'm not in this shoe is because I do not have the proper dressings to be near somebody who is suffering with the Ebola virus.
Thank you for having me.
Tell me a little bit about yourself. When did you come to Africa? What was your experience like?
I initially arrived in Bangui around 4 months ago. I am part of an organization called the Infectious Disease Specialists. Our doctors are stationed around the world, from other parts of Africa to the Middle East to Venezuela. I began treating people, but because of the lack of medical equipment and technology, I came down with the virus around 2 months ago.
Why did you choose to come help people here in Africa?
I knew that people had been struggling with healthcare in Africa for many years. I wanted to help as much as I could because they are people just like us, and they deserve proper medical attention and assistance.
Do you think it is worth it to come here to help people even though you have come down with the disease?
I believe it was very worth it to risk my life to come here and help those in need. The deadly virus has already killed more than 11,000 people in Africa alone. Although the Ebola virus kills about 65% of adults and about 74% of teens and children infected, my team and I have cured more than 140 people.
What is your message for people at home who want to help reduce the risk of doctors who go into developing countries to assist people?
My message is to support doctors as much as you can. Although there is nothing you can do personally to help these struggling people in Africa, it means a lot to help doctors in your community and out to reduce the risks of getting infected by diseases they are trying to treat. The more help you give, the more healthy the doctors are when they travel to developing countries, which means the more healthy people in the country get.
Thank you very much for meeting with me today.
Thank you for having me.